Chairman Klein and Ranking Member Miller, members of the committee, thank you for inviting me here to discuss the President's 2012 budget for HHS. The President's budget ensures Americans live within our means. As the lead up to the budget, we looked at all of our programs, cut waste, eliminated programs that weren't working well enough, redesigned our programs to put a new focus on result. And in some cases, we cut programs we would have kept in place in better fiscal times. At the same time, our budget protects the investments we need to keep Americans prosperous in the years to come, from investments in Head Start so our kids can compete with those in any nation, to investments in biomedical research that allows the U.S. to continue to lead the world in discoveries of breakthrough cures and treatments. Today, I want to focus my oral testimony on some of the provisions in our budget that will benefit the youngest and the oldest Americans. But first, a quick update on the implementation of the Affordable Care Act. Thanks to the steps we've taken so far, children can no longer be denied coverage because of their pre-existing health conditions. Families have new protections with the Patient's Bill of Rights. Businesses are getting some initial relief from the soaring health care costs, and seniors have better access to prescription drugs and preventive care. Tomorrow, we'll announce that more than 18,000 Americans who've been shut out of the insurance market are now taking advantage of the pre-existing insurance plans in their states. Some states are still reporting figures, so those numbers could go higher, but that's about a 50% increase in the last couple of months as people begin to learn about the program. It's encouraging to see that more people who need health insurance are getting it. But we know that's not enough, and that's why we're continuing to work with states and national advocates to reach eligible people and let them know coverage is available. We're also working with insurers that have chosen to notify people about the pre-existing insurance plan when their applications are denied. And we're evaluating ways to reduce premiums and ease eligibility standards to expand access to the plans. For many, these plans provide access to life-saving treatments, so it's vital we continue to find those who are eligible and get them enrolled. Our budget builds on the momentum of the Affordable Care Act with critical investments to provide for and protect our most vulnerable citizens. We know there's nothing more important to our future than the healthy development of all of our children. Science continues to show that success in school is significantly enhanced by higher quality early learning opportunities. Earlier this year, we got the results of a latest study to look at the value of early education. Researchers followed children from low-income families enrolled in Chicago early education programs until they turned 26 and found that over that child's lifetime, the program generated as much as $11 in economic benefits for every dollar spent. Now, that's a huge payoff. So even in tight budget times, our budget makes room for new investments in child care and Head Start, which have a long history of bipartisan support. But the budget does more than provide additional resources. It aims to raise the bar on quality in child care and early education by supporting key reforms to transform the nation's early childhood system into one that fosters healthy development and gets children ready for school. Quality child care is more than just providing babysitting. It supports healthy child development and school readiness, and that's why our budget puts forward principles for legislation reauthorizing the main child care program, the Child Care and Development Block Grant. These include promoting better health and safety standards, putting more information about the quality of different child care options into parents' hands, and improving workforce training to make sure that the people caring for our kids have the skills they need. We look forward to working with this committee, Mr. Chairman, as you consider these issues. We're also promoting better quality in Head Start, using new evidence-based evaluations in classrooms, including a tool that will help Head Start programs see what's working and improve what isn't. In addition, we've revamped the training we provide to Head Start directors and teachers to make sure best practices actually reach the classroom. And we're proposing new rules to require the lowest performing programs, the bottom 25%, to compete for funding. By giving programs incentives to raise the quality of their services and removing the weaker programs, we want to ensure that the best programs are the ones serving our children. Finally, we're pleased that the FY 2011 budget included funding to allow states to fund innovation in early education. and our 2012 request includes $350 million to continue this key investment. Taken together, these initiatives are designed to create an early learning system that gets every child ready for school, supports healthy child development, and features high standards, whether the child is in a pre-K program, a Head Start center, a child care center, or a family daycare home. They'll help ensure that American children start school as prepared as any in the world. Our budget also focuses on creating safe environments for children and families. We thank the committee for reauthorizing the Child Abuse Prevention and Treatment Act and the Family Violence Prevention and Services Act last year. And our budget includes more than $200 million for the child abuse and domestic violence programs authorized by these laws. The budget also provides critical support for seniors. It invests in the care and services seniors need to stay active and engaged in their communities. And it addresses the terrible problem of elder abuse and provides funding for caregiver services that gives families the peace of mind and enable them to continue to care for their relatives. These goals guide our department's work on the reauthorization of the Older Americans Act coming up later this year. For more than 45 years, the Older Americans Act has enjoyed broad bipartisan support. In the past year alone, the law's comprehensive home and community-based system has supported nearly 11 million seniors and their family caregivers. But the need for this kind of support continues to grow rapidly. Every day, more than 9,000 baby boomers turn 65. That's nearly 3.3 million a year, many of whom will be ultimately cared for by their family members. We need to do all we can to help families caring for their loved ones, and the Older Americans Act gives us the tools to do just that. We look forward to working with this committee to reauthorize the Older Americans Act and build upon the law's long record of success in serving our families and our communities. The 2012 budget makes tough choices and smart target investments today so we can have a healthy, stronger, and more competitive America tomorrow. That's what it takes to win the future, and that's what we're determined to do. Thank you, Mr. Chairman, and I look forward to our discussion.